If we really want us to actualize the digital agenda when it comes to digital health, we need one important element: pesa. Isn't that true? Isn't that true? We need to figure out how do we finance these initiatives, because we can talk about it, we can have good ideas, grand ideas, but if we don't know where the money is coming from and how the system makes money to sustain itself, then we are just building castles in the air. Isn't that right? But then we also need to talk about different communities. And for this panel, we'll be looking at young people. How do young people join into this conversation? We want to put all this representation in a panel and have a conversation, an open and candid conversation. Pay keen attention, write down your notes. We'll be definitely coming back to you to hear your thoughts and insights on the conversation, as well as any other questions to follow up on the conversation.
Our objectives for this Safe Mama Tech, we called this Safe Mama Tech. And one, we wanted to harness the digital connectivity and interoperability. We wanted you to go to each of these facilities and never get lost. So whichever place you go in, that data gets in, it still goes into your book. Then we said we are going to do something called value-based healthcare for these mothers, which means for every step you take, you are going to get a value. From the time you get pregnant until the child is immunized, that's a full journey. And so we measure how well is that journey. And everybody along that system gets incentivized. The community health worker, the health facility, and the mother herself for that journey. So if you do a good journey, all of you get incentivized. The third thing is about building private-public partnerships. And in our first ward that we did, we made sure that all the facilities which are private did an MOU with us that we are now joining this program. These are the outcomes that are required out of us. This is my contribution. This is the government contribution for us. And finally, we said we're going to replicate this model across all our PCNs. When we started, we were seeing almost 10,000 women. And you're wondering, how do you get 10,000 women in one small ward? And what was happening is that it's the same mother going to different facilities. She went to this facility, she didn't get iron. She went to the next facility to get iron. So she was registered there. She got her iron. She came back. This time she decided she's going to the market, I'm going to do this. So people were triple, quadruple registered. Once we did this interoperability layer, I think we have really eliminated that. Now we have correct numbers of who is who and who is where.
We have heard about the Taifa Care that is being used in Kisumu County and across the country. We've heard about the value-based care for mothers and babies through the primary health care network. Maybe the rest of the participants may not know, but we have heard about Marwa and the other digital health interventions that are being implemented in Kisumu County. So are you able to briefly expound on where Dr. Ganda left off on the examples in brief of the successful initiatives that, digital health initiatives that are happening in Kisumu County, or at least the ones that Dr. Ganda didn't mention, and base your answer on the actual success, because we know in every initiative, not all of them happen successfully 100%.
So out of all the interventions we've had, with Wonder Health, we started at the antenatal. We want our mothers to come in on time, that's at least before 12 weeks of pregnancy, so that we are able to walk the journey together for 8 antenatal care visits. We begin this in good time, and then with every visit, it is fed into the system. If there's a need or something that needs action, then immediately it's flagged. And we know this is a red alert, and we need to take immediate action. The beauty of this, that even if you're alone at work, you're able to be told what to do. For instance, if it is a high pressure, you're in a dispensary, you're told to immediately refer to a tertiary facility. So we are also having interoperability from the community up to the facilities in respect to the same. We also have the yellow alerts. Yes, not so bad, but still need some action to be taken and follow up also for the same.
What are the biggest human rights risks in Kenya's digital health rollout, knowing that the right to health is a human right that is being enjoyed by all Kenyans and others across the world?
What I would say is the Digital Health and Rights Project appreciates how the digital revolution, what the digital revolution is doing to the world. And it is happening everywhere, in every single sector, in one way or the other. And healthcare is just part of it. So the Digital Health and Rights Project is saying, yes, we agree. So many nice things are happening in the digital sector. But again, it is also recognizing that what is the weight that is coming with all these inventions, what is the weight that is coming with all this tech, especially particularly in the healthcare sector. So when we were doing the project, we were analyzing how human rights is intersecting with technology, and we were able to identify some key human rights issues that came up from the young people. So I will begin by mentioning the first human rights issue was the issue of access. I'm quoting our Article 27 of the Constitution that is guaranteeing each and every person, human being, guaranteeing the right to equality. We are all equal before the law, and we are entitled to equal protection and benefit under the law, as well as equal enjoyment of all rights. We are all saying digital health is a right. So we are saying every single person is entitled to enjoy this digital health revolution that we are talking about so much.
The weakest link is the end user client. So we have the patient, and I think my co-panelist has really brought that out. Your phone, there are many things you're going to be accessing through your phone. Are you digitally literate to understand that as much as we can say we are going to send you, I don't know, can you send encrypted data, which upon now you put a password? George, is that possible? And then now, we can make it more difficult for someone once they get into your phone to get your data. But the most important thing is you who has the phone. How are you keeping your phone safe? So that information that you don't want people to know about doesn't get out there.
We have seen very good initiatives and innovations. For example, collaboration with the private sector. Yesterday, if you attended the opening, Governor for Muranga, His Excellency Kangata, mentioned the collaboration that they have with Safaricom that has enabled health access through USSD code. So Safaricom has invested in a system that allows even for the people who use cellular phones to still be able to access their platform, the digital health platforms, through a USSD code. And I would say that's an innovative way which could be adopted by other counties.
Are there any steps that we are taking towards ensuring that we have adequate or progressive financing towards the promotion of digital health in Kenya and especially in counties?
Beyond the documents, one thing with financing is when you start realizing that investing in digital health is not a waste. The ROI has been shown to, the return on investment is is high, it comes back. But the biggest return on investment when you do digitization is when you realize that data, we like the cliche word that data is a new what? Oil, oil, black gold, what. But we only say it. I wish as Kenyans, we would appreciate what the value of utilizing data that we have collected to make insights and then do something about it.